May I come in?
Yes.
Good morning. My name is Marissa. I'll be your nurse today. Can I just have you verify your first and last name for me?
Alexa Paskov,
Perfect. And can I have you verify your date of birth?
8/17/96.
Perfect. Thank you. So Alexa, today what we're going to be doing is we're going to be doing a head-to-toe assessment. We're going to look at all the different body systems and just make sure everything's okay with you. It'll take about 20 minutes or so. Do you have any questions before we begin?
No.
Okay, so then first I'm going to ask you a couple questions. Alexa, are you allergic to anything? Food, medications, anything in the environment, or latex at all?
No.
Okay, and then on a scale of 0 to 10, could you rate your pain for me? So 0 being no pain at all, 10 being the worst pain you've ever experienced.
0.
Okay, so the patient's experiencing no pain at all. Good, so then we're going to go ahead and just get right into it. I'm just going to take a look at your general appearance first. So your skin looks to be even, the pigmentation looks to be appropriate for your genetic background. You look to be your stated age. Your height and weight look to be proportionate with that stated age as well. You look to be sitting up in an erect position. You don't look like you're in any kind of acute distress or anything. You're maintaining eye contact with me. Your speech is articulate and appropriate. Your facial features are symmetric with movement and they look appropriate for the event here. Also, it looks like you're dressed appropriately for the weather here. You appear to be alert to everything that's kind of going on around me. I'm just going to ask you a couple questions then. We stated your name already, so that's good. We're also going to do, can you just tell me where you're at right now?
In the doctor's office.
Okay, and then could you tell me why you're here?
For a physical assessment.
Okay, and then could you tell me just approximately what time it is?
9:20.
Okay, very good. So then the patient is oriented ×4 to person, place, event, and time. And then we're going to go ahead and just jump into vital signs. So for the purpose of this assessment, we're not going to actually take the vital signs, but I would assess your blood pressure, your pulse. I've assessed your respiratory rate, your temperature, and then also your pulse oximetry rate.
Perfect.
And then we're going to go ahead and just jump into the assessment. Then I'm going to start with your skin and your nails. So I'm just going to kind of reinstate. I did notice before that your skin was even colored. The pigmentation looks appropriate with your background. I'm just going to go ahead and just touch for temperature for your skin. Your temperature feels warm. Your skin seems dry. It's smooth. The color is even. It doesn't appear to be any kind of lesions or anything like that. I'm just going to go ahead and do a little pinch then, okay? That's going to assess your skin turgor, so there's no tending present. I'm going to go ahead and move down to your nails. Your nails look to be flat, and they look to be no clubbing present. I'm going to go ahead and just do a little pinch on the nail here and assess the capillary refill.
Sure.
Okay, and then capillary refill is present in less than 3 seconds then, so that's normal. Now I'm going to go ahead and just look at the skull. I'm going to palpate around, I'm going to touch, okay?
Sure.
And I'm going to assess the hair as well. So I'm just going to kind of touch around the skull here. So there doesn't appear to be any kind of lumps or bumps on the skull at all. The hair is thick, but evenly distributed, so that's good. The scalp appears to be midline as well. Your facial features are even, they are symmetrical with movement, so that is normal as well. And then we're going to go ahead and move on to eyes then. So I'm just going to kind of take a look at your eyes here. Do you wear any contacts or glasses at all?
No.
No. Okay, so then we're going to just do a little assessment here. I'm just going to have you look right at me, okay? And then I'm just going to shine the light into your eyes, okay?
Mm-hmm.
Perfect. So your pupils are round, even, they react to light. I'm going to go ahead and just want you to look at the pen here and just follow it with your eyes.
Mm-hmm.
Okay, so your eyes are converging and constricting, so they're accommodating. So that's good. I'm also going to go ahead and just look at your ears now. I'm just going to move your hair a little bit here. So the ears look to be symmetrical. The external part of it, there doesn't look to be any lesions. There doesn't look to be any drainage. I do note some piercings here. They look clean, well maintained, so no signs of infection with those. Proportionate to your head, symmetrical. And then your nose, I'm just going to kind of take a look on the outside. So the nose is midline, right in the middle of your face. appropriate positioning for the rest of your facial features. There doesn't look to be any drainage at all for the nose. I'm just going to have you occlude one nostril and take a deep breath in and out. Perfect, and then do the other side. Perfect, so then you're perfectly fine with breathing. There's no difficulty with breathing with one nostril occluded. And then I'm going to go back to ears. I did forget one test, so I'm just going to have you close your right ear here. And then I'm going to whisper something, and I want you to just repeat back what you hear, okay?
Sure. Pizza.
And then go ahead and do the other one.
Popcorn.
Perfect. All right, so then we're going to go ahead and move on to the mouth and the throat. So the lips, they look pink, symmetrical, moist. There doesn't look to be any cracks or lesions or anything like that. I'm just going to have you go ahead and open your mouth for me. Okay, so I'm looking at the teeth here. So the teeth look white, straight. There doesn't appear to be any cavities or any decay like that. I'm just going to have you stick out your tongue for me. And then if you could just push up the tongue to the top of your mouth. So the top of the tongue looks rough, the bottom looks smooth and glistening, and then also there's proper tongue movement. So that is cranial nerve 12 is intact. And then I'm just going to have you one more time just go ahead and stick out your tongue and say ah. Okay, so the uvula, it's rising and falling in the midline. The pharynx looks to be a dull red color, so that's all pretty normal there. Okay, I'm going to go ahead and move on to the respiratory system. So I'm going to just say that patient looks to be in a comfortable position. The breathing looks to be unlabored. It doesn't appear that the patient is using any accessory muscles to breathe at all. So I'm just going to go ahead and listen to your lung sounds. I'm going to listen anteriorly, so in the front part of your chest, and then posteriorly in the back. All right, so I'm just going to place my stethoscope and I'm going to move it in 6 different spots. Each time I move it, I just want you to take a deep breath in through your nose and out through your mouth, okay? Okay, and then I'm just going to go ahead and do posteriorly. Just move your head out of the way. Okay. All right, so your lungs are clear in all 6 positions, or lung fields anteriorly and posteriorly. There doesn't appear to be any adventitious sounds. So next I'm just going to go ahead and we're going to start the cardiovascular system. So I'm just going to go ahead and palpate the carotid artery. I'm just going to start with the one side. And then I'm going to do the other side. Okay, so that's palpated with A2 plus moderate strength. And then it's bilateral, so I'm going to go ahead and just listen then here. Okay, and there doesn't appear to be any bruise present with auscultation of the carotid arteries. Now I'm just going to have you just lay back for a second. I'm just going to go ahead and assess your apical heart rate for just 1 minute here. so your pulse rate is your apical pulse is about 86, so that is in with the normal range. So then I'm going to have you go ahead and just sit back up for a second here. All right, and then I'm just going to have palpate your radial pulses just at the same time then, okay? Okay, and then your radial pulse is felt with a 2+ strength bilaterally, so that's pretty normal as well. Now I'm going to go ahead and assess the abdomen, so I'm just going to have you lay back one more time here. Alright, so at first I'm just going to inspect the abdomen, so the contour looks to be flat. There doesn't appear to be any lesions. It looks symmetric. The skin tone is even and homogeneous. There doesn't appear to be any pulsations noticed as well. And now I'm just going to go ahead and just listen to all 4 bowel sounds. Sure. Okay, and then there are active bowel sounds in all 4 quadrants. And now I'm just going to go ahead and I'm just going to do a little bit of pressing on the abdomen. So you just tell me each time that I press down if you feel any pain, okay?
Sure.
Feel any pain there?
Mm-hmm. No.
No. Good. And now I'm just going to have you stay laying down. I'm just going to go ahead and take off your shoes and I'm just going to feel for your pulse on the feet here. And I feel that pulse, it is 2+ bilaterally, so that's normal. I'm going to have you go ahead and sit up now. And then the last thing we're going to do is we're just going to assess the musculoskeletal system. So I saw you when you came in, your gait seemed to be smooth and steady. It didn't appear that you needed any aids at all. You stand and you sit with no assistance at all. You're not falling over or anything like that. So I'm just going to go ahead and test the strength in your arms and your legs here. So I want you to just go ahead and hold up your arms like this. I'm just going to pull on them towards me. I want you to pull your arms towards yourself, okay? Good. And now I'm going to go ahead and push. You're just going to push towards me. Perfect. Now I'm going to go ahead and do the same thing with your legs. I'm going to pull them towards me first, so you pull them back. Good. And then push. Perfect. So the strength in your upper and lower extremities is 5+ bilaterally. And then and I think that completes our assessment. So do you have any questions for me?
No, I do not.
Okay, then I'm just going to be over here charting all your information. If you do have any questions, then let me know, okay?
Sure.
Thank you so much for letting me take care of you.
Thank you.